welcome to Puttaparthi via the internet to sunny Puttaparthi from sunny San Diego. So welcome to you. We're delighted to see you. The audience can see you on the screen and they can also hear you. And although you're not able to see the audience, we have a group of physicians. There's a group of IT specialists, both from hardware, software, various technology companies. There's also a large number of health management professionals here, as well as health management and IT students in the audience. So it's a diverse mix of clinicians, IT professionals, healthcare management professionals, so a very good group. So Dr. Sanjeev, we're going to talk for the next 40 minutes or so on mobile health applications, smartphone-based technologies, and how we can use this to improve healthcare. And this will be a sort of a two-way discussion between us and the audience members as well. So as we go through this discussion, I'd like the audience members to also ask some questions because I think that will help to develop a shared dialogue. Sanjeev, we know that smartphones are really growing all across the world. 3 years ago, when I gave a talk at a medical conference, I asked the physicians how many of them had smartphones, and maybe 5 out of 100 people actually raised their hands. And let me just ask this group, although this is a biased group because it's an IT group, how many of you have smartphones today? Let's see a raise of hands. So the entire audience is raising their hands. I think I should ask how many are not having smartphones, and just 1 or 2 of them or so. Okay, so these are those 4 or 5 people. Where have you been all this time? Okay, Sanjeev, tell us what's happening with smartphones, and particularly in the context of health-based technologies, mobile-based technologies. What's happening with smartphone penetration, and more importantly, what's happening with the technology that's required for smartphones to be able to be used as a medical device?
Those are great questions, Dr. Sola. Good morning, everyone. Sairam, it's wonderful to be with you. Thank you for this opportunity. Dr. Sola, you were ahead of your time asking people a while back about cell phones. It's certainly been an exciting era of digital technologies. Of course, the audience can appreciate this. And where we have unprecedented opportunities in what we've termed mobile health, to deliver health in a remote fashion. But what I'll do is I'll start with a little bit of slides in the background to actually give some precedence to the question at hand. But as Dr. Sola said, we'll keep this as an open dialogue because it is an exciting topic, one that we'll be able to build on together. So phones for health, and how do we even approach this question? I think the first way is, Dr. Sola, as you mentioned, about using cell phones. So 10 years ago, we wouldn't have been able to ask this question, phones for health. And this now, if we just take a step into the past of 10 years back, and during our previous Pope's inauguration, this was a picture at Vatican City. And as we can see, it looked like how it would in 2005. The only difference here is there's one lucky person who has a cell phone. If we accelerate now to 2015, this time during our current Pope's inauguration, it's hard to find a single person without a phone, much like how the audience in Puttaparthi has responded. So with cell phones, we've seen remarkable acceleration in global connectivity. The United Nations has put out statistics that as of 2015, the number of cell phones in active circulation have overtaken the global population, with over 7 billion devices currently being used. Well, what we've seen as with any technologies and Moore's law, the more you develop something, the cheaper it gets. And so smartphones, among the most powerful handheld computing devices, has seen a decline in its cost of production. And we're also seeing that phones are getting cheaper, and it's those phones which are being shipped worldwide. So we have more phones and more smartphones. They're also cheaper. With cell phones, we've seen remarkable progress in global connectivity with internet usage, Wi-Fi, and broadband. And this is only going to get better as of this year, with Google and Facebook announcing their drones and blimps to connect the quote-unquote disconnected of the world. So we're going to be even closer in touch, if we couldn't be more than that already. If we take this directly to home and the India connection, second to none over these past few years has been the acceleration in digital technologies with cell phone use, with almost all individuals here, 3/4, owning a cell phone and are connected.
But is it any phone, Sanjeev? I mean, if I buy some budget phone for, say, 2,000, 3,000 rupees, or do I need special type of phones with high-end Wi-Fi capability, etc., to be able to use?
Well, I think that's really the nail on the hammer question. As phones are becoming more technological and more sophisticated, there are still phones that are very basic, and those ones actually have demonstrated to be very robust for long-term use. And you're right, not in the context of how we want to use the phone for health, we may be able to leverage all cell phones in the manner in which we deliver healthcare. And I think you lead in very well into how we can do that with even basic phones. Mm-hmm. So if we were to just dissect a cell phone, can you see this?
Yeah, exactly. Yes.
Perfect. So if we even just look at this here as a smartphone, but if we look at the features of the phone and how we can deliver health, one of the first ways and one of the simplest ways is with text messaging. And if we take a closer look at this, text messaging is something we all do. We do it ubiquitously. We do it in our daily lives for our convenience. But there is also the potential for texting for health, for individuals, for pregnancy reminders, appointment follow-ups, laboratory results, and even to remind people to take medications. And it's interesting, Dr. Sola, as you stated, phones have been around for a long time when you first asked that question. And so people have been asking this very question about text messaging for healthcare delivery.
And does it work, Sanjeev? Does it actually improve their compliance, or does it reduce complications? How effective is that type of... It seems pretty simple, but there's also a tendency to ignore the messages. Does it actually work in reducing complications or improving adherence to medications and so forth?
I think that's great, because now we're substituting a physician or a healthcare worker with texting for reminders. And so if we take a little bit of a deeper look into that with two examples, one in Kenya for HIV medication adherence, where the investigators and physicians in Kenya had asked this question, that among 600 HIV positive individuals, by sending daily or every other day text messages that were just based on well-being, are you well, medications are important to make you feel better, to try to promote self-adherence. So you see, as you correctly stated, the only person that will take the medication is the patient. So we're leaving it in their hands. And what these investigators found was fascinating, that compared to standard of care, going into a clinic or seeing a community health worker, patients who received text messages for medication adherences had a 20% higher adherence. This group also saw decreases in their viral loads and improvements in their HIV disease progression, with a number needed to treat of 11 to achieve one person's viral load suppression. And this is a staggering number given how prevalent HIV is, particularly in developing countries. But if we use an example closer to home and in India, recently reported by investigators that some of you may know, they asked the similar question: can you prevent a disease with texting? So can you prevent diabetes? And what they did was they took 530 men who had glucose intolerance. So these are people at risk for diabetes. And they received lifestyle modification text messages. Physical activity keeps you fit. Use the stairs instead of the lift. Take fruit, not juice. For lifestyle modification. And what they found was also equally staggering, that over 2 years, with continued text message delivery and receipt, there was a 35% reduction in biochemically proven diabetes at 2 years. So here's a group of people who have risk for disease onset, And text messaging as a very benign intervention seems to be a powerful tool to prevent the onset of a disease.
It's really very impressive, especially considering that this requires no intervention at all. The next best technique that we have for producing or reducing diabetes is drugs. Drugs like metformin, which we use, which has a cost, which has adverse effects and so forth. So that's very impressive. If you can, say, improve medical compliance to reduce viral load in HIV or prevent the onset and then subsequent complications of diabetes simply through text messaging. But what about the more advanced features? Let's say I'm a doctor and I work in a busy hospital. I have an emergency room down, in a large, let's say, far away from me. Or I go to medical camps or mobile hospitals, areas where I don't have access to all of my big machines and equipment. What are the type of technologies that are available in smartphones that I can use? We've heard of the iECG, for example, or smartphone-based ECG. So let's start with that as an example, and let's go on to some of the other applications of smartphone-based diagnostic devices.
Sure. Now we're leveraging the cell phones and the smartphones in an even more provocative fashion. As we've seen, not just the technological advancements in cell phones and then global connectivity, we've also seen the miniaturization of medical diagnostics to handheld devices, to leveraging that phone to not just deliver healthcare, but also provide diagnoses at the point of care. So let's take a closer look into that. So we have yet another way to leverage a phone for delivering health in a developing country, and those are those mobile health devices. So it's that what you describe of providing point-of-care diagnostics. And so this is truly remarkable with these handheld devices. And as you can see on the screen here, these are a very small example of a very large and ongoing innovative field where the phone's camera can be leveraged as a microscope to be able to diagnose malaria, sickle cell, and even tuberculosis at the point of care. With smartphone cameras can also be leveraged to perform retinal exams. Now this in the absence of an ophthalmologist, optometrist, or even bulky equipment. The smartphone ECG, as you pointed out, for point-of-care rhythm analysis, and newly developed sequencing technologies to be able to diagnose a cancer also at the point of care. So really we're taking the hospital and we are mobilizing it into the field by leveraging smartphone technologies. And so there's these questions on, well, why point of care in developing countries? And I think, of course, the audience can appreciate all the many reasons why this can be important, including reducing cost of how healthcare is delivered, access to previously underserved areas. One thing that's very exciting is, can you improve the early detection, especially among people who don't have access to primary healthcare? So we had the opportunity to ask this question with these mobile health technologies and ended up in Africa earlier this year to ask the question, can point-of-care mobile diagnostics even be used in resource-limited areas? These are technologies which have been developed in industrialized nations. They're beginning to be developed at alarmingly fast rates in developing countries. And so we took what we had and said, well, can we do that in the community? So Dr. Sola, you asked a really good question. Can you use it in a rural location?
Right. How useful is it, and how applicable is it in Uganda or Zimbabwe or rural India, for example? Yeah.
Well, I think we'll certainly build on it, but I think one thing we can even discuss is where the need is great, the impact has the potential to be great. So we know that by statistics, but we still had to assess, well, can you deliver it? As if you can deliver diagnostics where it wasn't there before, can that improve healthcare delivery in these areas? So as we went to address the question, and much like you're stating, in a resource-limited area, in individuals, in centers where there is not access to primary diagnostics, we deployed these technologies in a pilot study to see if they can work. In the city where we were, it was functioned as a resource-limited area does, with limited healthcare workers and also an incredibly large service area. And so we use these devices that we say are for vital signs: blood pressure, oxygen monitors, glucometers, smartphone ECG, and the handheld ultrasound. And asked, can you use these in the community? But as you were saying, can you deliver these? Is it important? Well, one of the most important features in these areas is to engage the community. And so cell phones on their own don't work unless you have a large infrastructure behind you. And so engaging healthcare systems, solar energy companies, cellular phone carriers, people who are invested in how healthcare can be delivered. And so, Dr. Sola, I have a question for you now. Okay. In this very rural community in Africa, or even a question to the audience, what percentage of people in this rural town do you think had a cell phone?
Okay. Any guesses from the audience? 80%? 80% seems like a good number.
The person who answered must be in their 20s. Everybody has a cell phone. You are absolutely right. In the sample of individuals that we saw, it was as high as 85%, which is quite remarkable that, yes, everyone does have a cell phone. In these particular communities, as you asked the first question, is it all cell phones? Well, here it's mostly non-smartphones. And from a cost and socioeconomic perspective. And so we charted out to then create mobile healthcare clinics. The credit is also to my wife for building it together. That we used these mobile health devices in a hospital clinic where individuals had come from the community for mobile healthcare diagnostics, for heart disease, for diabetes, for hypertension. And where we were able to use these devices, like the iPhone ECG for point-of-care rhythm analysis, here in a pregnant woman who was complaining of palpitations, to be able to give her a diagnosis, or the best that we could, at the point of care. But really what we're asking is, can mobile diagnostics be mobilized into the community? Instead of people coming to the healthcare system, can you bring it to the people? And so the second objective was to create a rural mHealth clinic here on the grounds of a school that my wife and I run for people in the community who had no access to healthcare previously. And we found that you can use these devices for community-based hypertension screening, pediatric-related heart disease, here for coronary artery disease, and to provide the diagnostic at the point of care. Now, it did take us as physicians to be able to diagnose, but now we are empowered to be able to do that in a rural area. And a major factor, as most in the audience are thinking of as well, if engaging local practitioners was the main goal. Is empowering local practitioners is how these technologies work in a rural community. Here's an example of how these diagnostics can be performed at the point of care. Here in a young boy who was complaining of palpitations and had congenital heart disease. And here the point of care ultrasound, which demonstrated valvular heart disease and structural heart disease. This in a hospital system which did not have access to an ultrasound and their ECG machine, which was broken. So it proved to be very useful in how we can, in lessons learned with how we can use these devices in a rural location.
So you're taking devices, let's say an ECG machine or a full-fledged echo machine, and you're miniaturizing this into a handheld ultrasound or a single lead ECG. It's not the same as a full 12 lead ECG. And I think the mobile health, we've used the handheld ultrasound also at Sathya. It's not the same as a full-fledged echo machine, but I think it can definitely tell you who needs more care or who is normal and can be treated without anything. Tell us about these high-end tests, though. These sound pretty interesting. Can I really diagnose malaria and tuberculosis with my cell phone, or can I really look at cancer with my cell phone? How does that, how are those, sort of this, what they talk about, the lab on the chip type of technology? Right. So if I take my phone and have some adjacent device that connects to it via Wi-Fi, I can actually make diagnoses with, I can check blood sugar with saliva sampling, for example, and so forth. How does that work? What's the technology behind that?
Sure. Now we're really accelerating into almost the 22nd century with the types of technologies where the previous examples were of structural related abnormalities, vital signs, but it is equally exciting to be able to see very intelligent and innovative technologies that can leverage the smartphone again for point-of-care laboratory testing. We can also use these tools for telemedicine, where now using the camera function on the phone, we're able to now bring a healthcare worker's experience remotely to an area, where here there's a teledermatology, to be able to, for a healthcare worker to be able to see what's going on in a remote area. The iPhone retinal scan, for again, an ophthalmologist to be able to see remotely what's going on with the patient. And this, using connectivity, can now transmit that information back to you who are viewing these tests remotely. But now as we talk about teleconsultation, it's also telehealth. Now here in a rural location, individuals who don't have access to specialists can now have that access and that transfer of knowledge. Here an example used in India of smartphones to be able to review diagnostic testing by healthcare workers who are in urban areas. But as we were talking about, is what are the sophisticated testing? Well, mobile imaging is certainly one of them. Here, there's thermal imaging using the smartphone for X-rays, but unfortunately, to our dismay right now, these are not yet available technologies. But what we do have is handheld ultrasounds. As you saw in the examples, using the smartphone now for tertiary diagnostics.
Mm-hmm. We have these at our hospital, and it's been very good. One of the issues with handheld ultrasound is that we still have, in India, we have the PNDT Act, the Prenatal Diagnostic Act, which limits the use of ultrasound. But we found that in most centers, because of these handheld ultrasounds are considered as screening devices and not as full-fledged ultrasounds, they sort of fall outside the scope of the PNDT Act. So that's a legal implication that's important in our country, and it depends on the setting. So we couldn't use it, say, for OBGYN, but we could use it for screening in certain areas. So that's an important restriction or important limitation.
Absolutely, and I think these are very important questions, to ask now, as these technologies are developed and how we go forward with using them. As you were alluding to about, can you do laboratory testing on the phone? And so leveraging the computing power of cell phones, there are smartphone attachments that can perform HIV and syphilis testing with a single drop of blood in less than 15 minutes, mobilizing the laboratory. There are others which use, and I'm sure the audience is also familiar with rapid diagnostic tests, malaria, tuberculosis, other diseases, but using the camera feature on the phone and an attachment that can do automated diagnostics better than the human eye. And finally, one of the most exciting right now is an iPad-sized laboratory that can perform bacterial, viral pathogens, and even cancer detection with DNA sequencing by leveraging the computing power on phones and the miniaturization of technologies. So this is probably one of the most interesting areas in mobilizing healthcare, particularly for developing countries. So I hope you're fascinated with these developments, Dr. Sola.
Very much, very much. So we have then a series of technologies that can be used in diagnostics, and now starting from simple text message-based interventions to more complex diagnostic, simple things like blood pressure, sugar, and ECGs, to more complex diagnoses like HIV, syphilis, even cancer detection, tuberculosis, and malaria, I understand. But what are the challenges that these types of technologies face? I mean, are these FDA approved, or do I have to go through the legal regulatory framework in a particular country to get approval to use these devices? And how accurate are they compared with the standard laboratory, sort of whatever is the current standard of care? How can you give us some examples, or what's the role or limitations of these types of devices in that setting?
Sure. Those are very good questions then about how we use these technologies to deliver healthcare. So some devices are FDA approved and approved by the European Union, or where they're developed. And in doing so, they must demonstrate validity to a gold standard. So the ECG, as an example, must show diagnostic validity to a conventional single lead ECG. And you bring up a very good question, and that is using the mobile health diagnostic in the manner in which it's created for. See, a single lead ECG is just as good as a single lead ECG. It will tell us only what it can as heart rate and rhythm. It cannot infer heart disease as such as a 12-lead ECG can. But as these technologies are being developed in industrialized nations, they're also being developed in developing countries. And they'll follow along the regulatory pathways that are required for most any medical device or medical technology. And in doing so, it's important for everyone to realize that how the technology is being developed is only as good as how it can be used.
So that goes into the next question. Let's say that the FDA has approved a new device for whatever specialty or whatever area, and we know that the FDA has actually issued guidelines on the development of smartphone-based technology, mobile applications, and how these should be developed, etc. Let's say that I have a series of these smartphone-based technologies. Let's say I've thought the issues through. I've thought about things like battery backup, where am I going to charge my devices, and so forth. But how easy are these to use? In other words, if I give this to my nurses in my mobile hospital, or to the physicians that come, and these physicians, let's say I have a medical camp where physicians are coming in an outlying or rural area, they may not have used these types of devices before. How easy is it to train them in these? Certainly, if you have a highly trained individual with any technology, the quality will be very good. But let's say you take untrained individuals. What's the training? What sort of challenges have you seen there in your previous experience?
Sure. Again, it's a very good question about how these technologies can be used in the real world. And so when we were curious about that question and had asked a corollary question, that if people are using smartphones, are they digital savvy? That these technologies, I think Steve Jobs had said when he was around that a 2-year-old could use an iPhone. And he may be right, that the technology's user friendliness and their form factors make them simple to use. Now, a very important factor in how these mobile health technologies are used is medical education. And that is they have to go together in order for them to be used, particularly in a developing country or in a rural area. That to be used by a healthcare worker. We asked the question in Uganda, are healthcare workers physicians, or all healthcare workers can use them? And we found community health workers, nursing students, medical students, and even teachers were able to pick up the nuances of mobile health device use because the form factors were easy. They were easy to access by applications on the smartphone. And the smartphone then gives you the diagnosis by automated algorithms. So it proved to be the form factor which was useful, but then where we learned that medical education was the key. And in order to perform an iPhone ECG, one must be able to understand what is being recorded to be able to then make determinations for patient care.
So with training then, these devices can be used quite easily. Let's go into our last question then. You had joined us in Whitefield at the Srikant Sola Institute there in August as part of the American Society of Echo Foundation Values Program. And for the audience, this was a program in which we invited some 300 patients with rheumatic heart disease. This is a type of heart disease affecting the valves in the heart. And we were looking at how we can use modern high-end echocardiography to better manage these patients, because most of the data and most of the guidelines that we have focus on non-rheumatic heart disease, whereas in India and other developing countries, rheumatic heart disease, which is a specific subtype, is quite dangerous, quite fatal, and has tremendous morbidity and mortality. What we did during this time is we also randomized these patients, about 250 patients, to either receiving a traditional workup, which means your standard physician examination, full-fledged echocardiogram, ECG, etc., and then a diagnosis and treatment plan was based on that. In addition, half of those patients went through the same thing, that is, they got the conventional evaluation, but they also got, in a blinded fashion, a mobile health assessment. And so these patients were taken through an iPhone ECG, a mobile pocket or handheld ultrasound, and an activity monitoring to better assess their level of fitness or physical limitation if it was present. And so we looked at how accurate or how good was the diagnosis made by the physician using the smartphone-based technologies versus the high-end, complex, complete evaluation made in the traditional hospital setting. Sanjeev, can you tell us what you found and what happened in those patients? How good was the mHealth clinic compared to the standard of care?
Sure. Does this slide project?
Yes, yes, very much.
Yes. So as you were saying, so we had an incredible partnership and initiative just a few months ago to be able to ask those questions. Not only can these technologies be used, can they used in a pragmatic fashion using the resources available at SSSI, but also can they impact outcomes? Can they impact the healthcare outcomes for the system, and patient outcomes? And so we learned very valuable lessons on how doctors here engage with and nurses engage with mobile health clinics. And what we're finding now as this trial is ongoing and follow-up is that compared to the standard of care, mobile health clinics that is performing these diagnostics with a patient in a mobile fashion, we found that physicians were referring patients for balloon valvuloplasty and valve surgery more frequently than the standard of care clinics. We were also finding overall that individuals in the mobile health clinics are undergoing these treatments a little bit more frequently than the standard of care clinics. And so we're looking at outcomes now that if you provide early diagnostics with mobile health, can it impact 1 year, even longer term outcomes among patients? So it was one of the most incredible educational and academic initiatives that I've participated in with you and the staff at SSSI, but to ask these very important questions, and particularly a patient population which is very large, underserved, where we can improve the outcomes among these people. So it's certainly more to come with that, but as you were saying, something that we learned a lot from.
Great, Sanjeev. Thank you very much for a very stimulating and outstanding discussion. And let's give a big round of applause to Dr. Sanjeev, please.